Hi, my name is Bob Mueller, and I'm here today to share a little bit with you about the CDC's indicators for dynamic school decision making and about an unofficial case rate that we're producing to support work with this, with the CDC's guidance. The primary message from the CDC is that you should balance risk that's present in the community with mitigation efforts in the school. So if a school is at medium, high, or highest risk, we essentially adopt a stance with mitigation that is appropriate for that level of risk. The CDC proposes two core indicators. The first one focuses on community burden, basically how prevalent is the virus spreading within the community. And the second is how able is the school to implement mitigation strategies correctly and consistently. So in terms of looking at community burden, the CDC recommends that you use one or both of what I have here. So the number of new cases per 100,000 people within the last 14-day period, or the percentage of PCR tests that are positive during the last 14 days. When we go to the county's data sets, we're able to produce a 14-day case rate by zip code, but we're not able to do the same thing with test positivity. So we are producing this case rate for you. So essentially, if you have more than 200 per 100,000, you're in the highest risk category. If you're in the 50 to 200 per 100,000 range, then you're in the higher risk of transmission category. If you're in 20 to 50 cases per 100,000, moderate risk, and then it goes down from there. In terms of the other core indicator, how able is the school to implement prevention measures? If we were looking solely at that, then if you're able to implement all 5 strategies, face covers, physical distancing, good hand hygiene and respiratory etiquette, cleaning and disinfecting, and you're very able to assist public health with contact tracing, and you can do those things correctly and consistently, then that brings the risk down as much as it possibly can. And to the degree you cannot do those things, the risk gets a little higher. If you're not able to do any of those things, then you're at highest risk. So let's take a look at the case rate that the CDC proposes that you use. The 14-day case rate that we're providing to you is not official. It's not created by the County of San Diego. However, we are calculating it using official data. We will update this for you every Tuesday. It will always be for the 14 days preceding the date that we update it. So essentially Tuesday 2 weeks ago through Monday, and then the update is on Tuesday. So the date will always be at the top of the table up here. The table provides official population estimates for each zip code, the number of cases that were reported during that 14-day period, and then it gives you the number of cases per 100,000. Because population sizes vary by zip code, it's necessary to have a case rate per 100,000 so you can make comparisons from one zip code to the other or to the county as a whole. When you open this page, the default setting is to show all of the zip codes in the county. So at the very bottom of the table where it says 4 zip codes selected, it will give you the population total for the county, the number of cases that occurred in the county during the 14-day period, and then it will calculate the 14-day case rate for the county, which would be in this case, 104 over 100,000. You also have the option of using the zip code filter at the top. When you use the zip code filter, you can focus in on just the zip codes you're interested in. This will bring back results for just those zip codes, but it will also total the amounts for all of the zip codes combined. So if you wanted to look at your entire school district and you had 5 zip codes there, you could select those 5 zip codes, and at the bottom under the table, it will show you for the zip code selected a total, the total population for those zip codes, the total number of cases that occurred during the 14-day period, and it would then calculate a case rate for your district if you selected all the zip codes within your district. So using that information, you could then start to map out what would our mitigation stances be for each level of risk. So I provided some examples here. Honestly, these aren't prescriptive. There isn't really clear guidance on what stances you should adopt at each level. So just kind of putting things together from all the things I've read, I proposed a few things for you to consider. But ideally, you form a work group of local experts, you get some input from an epidemiologist, and you say, if we're at the highest risk, 200 per 100,000 or more, we're going to take this stance. And what I'm suggesting is maybe then you limit your in-person instruction and services to just the students with the greatest needs, that you're bringing in a very small part of your student population. And while you have them there, you would follow the state's guidance that they issued on September 4th for working with small cohorts when transmission is at high risk. At the next level down, the 50 to 100,000, you might consider a form of hybrid instruction. You'd use strict 6 feet of physical distancing between student desks. The guidance says you can use physical distancing as practicable, but because you're at higher risk, you would want to follow the strict guidance, which is typically 6 feet or more between people. You would limit cohort size based on the capacity of the room with physical distancing in place. You would want to maintain those cohorts as stable and not allow them to mix students from one cohort with another cohort. Ideally, you would keep the adults that work with each cohort the same. And that instead of using regrouping for special services like for speech therapy, you would provide individual services during this higher risk, during this higher period of higher risk. I've also listed some for moderate, lower, and lowest risks, but the idea is adapt the stance, become more strict, more conservative as you have higher risk, and you can slide along the continuum to a more relaxed state, allow a little bit more mixing as you get down into the lower risk categories. If you have questions on this, I'm happy to take your calls or answer your emails. I would also refer you to the information from the CDC, which I'm sure when we provide this video, we'll also have links available so you can do your own reading. Thank you very much.